Hello and good morning everyone. So I am Dr. Ranjit Shah, an infectious disease expert as well as clinical research from Harvard Medical School. We were revising this USMLE Step 1 2021 microbiological section where we are on page 150 discussing about this rickettsial disease. We have completed in the previous lecture about rickettsial disease where we have discussed about this Rocky Mountain spotted fever, typhus and less rash occurring disease like ehrlichiosis and aplasmosis, but after the rickettsial species, and also about the Q fever which does not require any vector but can spread from this placental related delivery of a animal, and that leads to the acute case in cause pneumonia and hepatitis, and chronic case it can lead to culture negative infective endocarditis. Now talking about this Mycoplasmin pneumonia. Mycoplasmin pneumonia is one of the smallest bacteria that lack the cell wall and free living. So this is the important, makes them important. They do not have cell wall. So any cell wall acting antibiotic will not act on them. So all your beta-lactam antibiotic like penicillin, cephalosporin, carbapenems, they all become useless in Mycoplasma pneumonia. So they don't have the cell wall. They are the smallest bacteria. So you can remember in that ways also. And they have only the cell membrane where they contain the rich in sterol or say cholesterol. So these 3 points have to remember about Mycoplasma pneumonia. So it has no cell wall. It is the smallest bacteria and its cell membrane will contain the rich amount of sterol, cholesterol or say sterol. That is important. Another important point you have to remember is this is the bacteria that will cause the community acquired pneumonia in the young patient, and that is actually the pneumonia, the chest x-ray. If you see the patient with chest x-ray will be severe, but patient will have this walking pneumonia. Since the patient doesn't develop high fever, but there will be only dry cough, no sputum production, and patient will be walking normally. Patient will have this bad hexy cough, but since lack of high fever or lack of seriousness or say a toxic look, they can easily move in a community and can spreading the disease as well. This is called walking pneumonia. A patient having the symptoms, having the pneumonia in the chest, but less severe symptoms, but has this cough, and they are walking in the community easily because they are not feeling very sick, but their x-ray, their chest x-ray looks very bad. So that type of pneumonia is called walking pneumonia. Patient is having the disease, but they are easily moving or going to the college or say going to their work. They are they are easily moving in the family, so they are not bedridden. So it is known as the walking pneumonia. So we have 4-5 things to remember. One, the smallest bacteria, they do not have cell wall, so beta-lactam antibiotic, penicillin, cephalosporin will not act. They contain only cell membrane that rich in the cholesterol, and they have actually developed the disease that is called the walking pneumonia. They cannot, since there is no cell wall, there is difficult to stain, so they will not come in any stain. Okay, and the treatment will be other antibiotics like macrolides, the azithromycin, doxycycline or fluoroquinolones. Penicillin will not act on them. Let's go through the text. So Mycoplasma pneumonia, this is classical cause of atypical pneumonia called walking pneumonia. This is the insidious onset, headache, non-productive cough, patchy or diffuse interstitial inflammation, and macular rash. So what the patient are developing? The patient is developing insidious onset. This is not sudden onset anything. Insidious onset, there is headache, there is non-productive cough, you have cough, dry cough, there is nothing coming out, patchy or diffuse interstitial infiltrate. So if you see an x-ray, in chest x-ray, you will see this patchy one location, or diffuse lung field there will be infiltrate, interstitial infiltrate will be there, which can be seen with the color change, whitish appearance, and there will be a macular rash. So this will be the presentation of your Mycoplasma pneumonia patient. Occurs frequently in those with less than 30 years. That is important. They can infect the people, mainly to the young people, less than 30 years old. Outbreaks where occur? Outbreaks occurs in the people where he lives in the crowded places. Like we as a student where you live in the hostel, the military groups are living in the military. They can outbreak occurs in the military recruits, in the prison where a lot of people live together, in the college, so in the hostel. So these are the places where lots of people living in community, in a closed spaces, crowded spaces, their outbreak occurs. Treatment, we have known the penicillin will not work on it. There will be the treatment option like macrolides, say doxycycline or fluoroquinolones. Penicillin ineffective since Mycoplasma have no cell wall. So talking about again moving forward, this is not seen on the gram stain. I have already told they don't have the cell wall, so they cannot be seen either in gram. They will not be either gram positive or gram negative because they don't have cell wall. Gram stain is on the basis of the staining of the cell wall. So these are not seen on the gram stain. They are pleomorphic. Bacterial membrane contain sterols for stability. So the bacterial membrane has the sterol, which makes them stable. Grown on the Etion agar. Etion agar is a cholesterol-rich agar, when which it's grow, and then in any cholesterol-rich media they appear as a fried egg appearance. I will show you the images. The chest X-ray appears more severe than the patient presentation. So that is also I have explained you that if you see the patient looks normal, they are working, they are doing their work easily, the household work, daily work. But if you do the X-ray, there will be a severe infiltration, or say patchy or diffuse infiltration. One of the tests we can do is high titer of cold agglutinins, that is IgM, can agglutinate RBC. So if the person, you take that person blood, you to put in your blood tube or vacuum tube, and you put in the cold environment, what happens? The cold agglutination will agglutinate all the RBC on the surface of that your blood collection vial or bulk collection vacuum tube. So that is called cold agglutination. That can be done to demonstrate the cold agglutinin IgM antibody of this Mycoplasma pneumoniae. Mycoplasma gets colds without cold, so they doesn't have cell wall, but in cold they agglutinate, so they are called the cold agglutinin. They can cause atypical variant of Stevens-Johnson syndrome, typically in children and adolescents. So beside pneumonia, this bacteria can lead to a severe condition called Stevens-Johnson syndrome, and typically in children and adolescents. I have one of a publication that was a young lady which was developing this Stevens-Johnson syndromes, and later it was due to this Mycoplasma pneumoniae. Let me take you to this picture of this Kaplan book, where we'll talk about this Mycoplasma pneumoniae. This Mycoplasma is a smallest free living bacteria, that is extracellular bacteria, missing peptidoglycan, no cell wall, sterol in the membrane, required cholesterol for vitro in culture, fried egg colony on the Mycoplasma or the ectone media or metion agar. Medical importance are Mycoplasma pneumonia and ureaplasma ureolyticum. Distinguishing feature of Mycoplasma pneumonia is extracellular, tiny, flexible, no cell wall, not seen on the gram stain smear, membrane with the cholesterol but does not synthesize cholesterol, so requires cholesterol for growth extracellularly or in a vitro culture medium. Reservoir, human respiratory tract, transmission, water respiratory droplets, close contact, family, military recruits, medical school classes, college dorms. So young adult with atypical pneumonia, mulberry-shaped colonies on the media containing steroids, and positive cold agglutination test. These are the three things by which you can diagnose this Mycoplasma pneumonia. So young adult, there should be a presentation. There will be a fried egg or mulberry-shaped colonies on the media containing sterol, that is Eton agar or say Peplo agar, and there will be a positive cold agglutination test. Positive cold agglutination is a very simple test. You just draw the blood, put in a vial or vacuumator, and then put in the freeze. Putting after 5 to 10 minutes in the freeze, when you bring that vial, you can see that RBC are agglutinated on the surface of their medium. This is known as the positive cold agglutination test. Pathogenesis: surface parasite, not invasive, attached to the respiratory epithelium via PI protein, inhibit the ciliary action and produce this hydrogen peroxide, superoxide radical, and cytolytic enzyme. So what is happening? They are entered inside your respiratory epithelium. They are attached there by this P1 protein. You inhale the bacteria goes into your respiratory epithelium. They attached with the help of this P1 protein. After in P1 protein, they inhibit the ciliary action. Ciliary action in our respiratory tract is to clear the respiratory passage, so we do not develop any reflexes, cough or any sneezing or anything. So if the ciliary action is inhibited, now cilia is not moving, your respiratory, all the secretion are getting accumulated. They produce this hydrogen peroxide, superoxide radical, and cytolytic enzyme, which damage the respiratory epithelium, leading to the necrosis. Since there is a cilia is now stasis, it is going on, the epithelium are undergoing damages, so they are leading to necrosis, and this is irritating your throat, that is leading to a bad hacking cough. So you have a severe cough, you have a hacking cough, that is called walking pneumonia, but you do not produce sputum because there is nothing damaged in the lower one. There is the respiratory epithelium, upper respiratory tract is damaging, and you are irritating is developed, and you are causing this walking pneumonia. Walking pneumonia function as superintendent, elicit production of the interleukin 1, 6, and TNF. This disease, walking pneumonia, that is pharyngitis, may develop echotic pneumonia if there is lung parenchyma is also involved, that is atypical pneumonia with persistent HAC, little sputum is produced, most atypical pneumonia along with the virus in the young adult. Diagnosis, we can primarily diagnose clinically. We can do the molecular tests like PCR or nucleic acid probes. We can even do the serological tests like ELISA and immunofluorescence sensitive test. You can culture this organism, and culture will be long, it will take long duration, and it will be hard to culture in your any normal lab. You need a reference laboratory to culture this organism. In culture, they will appear as the fried egg shaped colonies and sterile containing media in 10 days. So it will take around 10 days. It will long lasting. In that time, your patient will be serious or your patient will improve. So you have to treat your patient clinically. You should not depend on culture for treating your patient. There will be a positive gold agglutination test. I have told you about this. Our antibody to the RBC test is non-specific and positive only in 65% case. But this is a simple test. You draw the blood from a patient, put it into the blood collecting tube or vial, then put that vial into the refrigerator at 4 degrees Celsius, and after a few minutes, if you take out and observe, there will be all RBC will be stick towards the that is the wall of this tube, and there will be agglutination is seen. This is called cold agglutination, and that is due to IgM, which is known as a cold agglutinin, and that is in the Mycoplasma pneumonia. Mycoplasma pneumonia can be demonstrated in that way. Even I have a publication on Stephen-Johnson syndrome due to Mycoplasma pneumonia, and where we have demonstrated in this way and save that patient. So this is non-specific, less sensitive, but can be helpful test in Mycoplasma pneumonia in a situation where you don't have the molecular test and you know the culture of this organism is very, very difficult. So treatment wise, we can know erythromycin, azithromycin, clarithromycin, or so penicillin group of antibiotic will not work, other will work. There is another species, Ureaplasma urolyticum, that is causing urinary tract infection. They are urease positive, and they also are not gram staining. So if you talk about UTI, urease positive, you normally think about the Proteus species, but there will be a Ureaplasma urolyticum, but Proteus is gram negative bug, that is a motile bug. This will not seen on the gram stain, and they will treatment with the erythromycin. Before closing this lecture, let me get to you to some of the images to make you more impact to understand this. If you see this picture, this is the Mycoplasma colony with the Dean stain. This is the Mycoplasma pneumonia with this fried egg appearance on the papillogar. So this is the growth only after 10 days, later grow, but if we can demonstrate it, then this will appear as this fried egg colonies. Let me start from beginning. This is Mycoplasma pneumonia, plural Mycoplasma or Mycoplasmata is a genus of bacteria that lack the cell wall around the cell membrane. This characteristic make them naturally resistant to antibiotic that target the cell wall synthesis. That is beta-lactam antibiotic. They can be parasitic or saprophytic. Okay, so their colonies appearance we have already discussed. This can be a Mycoplasma colonies with a Dean stains. That will be the Mycoplasma colonies, and the papillogar will be appear as this fried egg appearance. Let me focus you over here. This you can see there is the fried egg colonies. So this will be appearance of your Mycoplasma pneumonia on any cholesterol agar, maybe etone agar, or you can say Mycoplasma agar, or you can say papillo agar, papillo agar. So moving forward, a Mycoplasma pneumonia patient will develop the symptoms like chest pain, chill, cough, excessive sweating, fever, headache, or sore throat. There, if you see this Mycoplasma pneumonia, they are called walking pneumonia, cause milder type of pneumonia. Risk factor are those who live and work in the crowded setting, like in a classroom, school and college, resident hall, military barrack, hospital and nursing home. These are the risk areas where this outbreak occurs. Mycoplasma pneumonia atypical, cause atypical pneumonia usually occur in children and adolescents, cause tracheobronchitis and pneumonia, spread bacteria by coughing and sneezing. The complication, the seriousness developed by this bacteria are serious pneumonia, erythema multiforme, asthma attack, renal dysfunction. The more severe form is Stephen-Johnson syndrome, encephalitis, hemolytic anemia. So you have to remember this can also lead to, this is the infectious cause of your Stephen-Johnson syndrome. Then you can see Mycoplasma pneumonia, this causes atypical pneumonia in young adults. You see the cell membrane, there is no cell wall, lack of the cell wall, there is a cell membrane which contains the sterol. Don't take up the dye under gram staining, cannot be visualized under the light microscope. They are osmotically unstable in the external environment and highly pleomorphic. So for diagnosis, Mycoplasma pneumonia, an assay for the separate detection of a specific IgM or IgG. So for the separate detection of specific IgM or IgA antibodies should be applied. Elevated IgM antibodies represent a reliable indicator of Mycoplasma infection. in children, but IgA based diagnosis provide higher sensitivity in older patient. If you see what are the culture, what are the diagnostics method we have, we can do the culture, but culture will take long time, and sputum will be the sample. If you take the serum serological test can be done, or you can go for the direct micromolecular test where you can sputum, you can, or your nasopharyngeal wash can be taken and demonstrate the organism. So if you talk about the community acquired pneumonia, Mycoplasma pneumonia come as the one of the commonest organism to cause you the pneumonia. Although Streptococcus pneumonia is the most common, but you have to remember community acquired pneumonia, atypical pneumonia, the Mycoplasma comes in the first in the list. These are the chest X-ray feature where you can see the patient will be normally walking and talking, but their X-ray, when you do the X-ray, it will be severely damaged. There will be a patchy consolidation, or there will be diffuse in interstitial infiltrates, and the X-ray looks actually bad. So you need to treat with like doxycycline, azithromycin, or fluoroquine antibiotic, and then the patient will be improved in few days of treatment. Hope you have understood this Mycoplasma. This is the smallest bacteria without cell wall, so no stain, no action of this penicillin antibiotic. They can lead to pneumonia, and they can even lead to severe Stephen-Johnson syndrome. There is a bedside test called cold agglutination test, in which you draw the blood and then you diagnose the patient bedside and start the treatment. So hope this is helpful. Thank you.